Hi, my name is Boa Barbara of the group 2-4. This is my final product, the knowledge from all the weeks. Week 3. What I learned during the semester from week 3 to week 7. Some different types of dental exams are comparison exams and checkups. What happens during a dental exam? The dentist will clean your teeth and examine your cavities or gum disease. The exam includes an assessment of your risk for another oral health problem and will examine your face, cheek, and mouth for abnormalities. A dental exam might also include dental x-rays. Week 4. The types of radiography used in dentistry are intraoral, occlusal, interproximal, orthodontography. X-rays are often used to plan dental implants treatment, check for impacted with some teeth, and detect jaw problems. Week 5. Some examples of dentures are crowns, veneers, bridge, implants, dentures. People need dental braces to regain chewing, aesthetic, and phonetic functions, also to replace one or more teeth. Week 6. The type of problems that require orthodontic treatment are when the bite does not fit, gap between teeth open by premature loss of mid-teeth, dental alternation. If a patient does not receive orthodontic treatment, they may have jaw problems, tooth enamel wear, tooth loss, tooth decay, gum disease. Week 7. Tooth decay is usually caused by excessive consumption of sugar, poor oral hygiene, which causes bacteria plague. If tooth decay is not treated, the mesh spreads, affecting the pearl layers, several toothcase infections, and loss of the teeth. Week 8. When a dentist fills a tooth, the dentist will fill the space with any filling material. The hole needs to be filled to prevent bacteria build up in the area and protect your teeth from future cavities. After filling the cavity, they will file a smooth tooth to make sure it doesn't interfere with your chewing. This process will be complete in a few minutes. Different substances can be used by dentists to fill teeth. Usually, the product involves replacing the decayed tooth material with filling, which can be made of resin, ionomers, gold, amalgam, or ceramic. Week 9. Root canal treatment is necessary when an infection occurs that affects the root canal. A dentist performs a root canal treatment if the tooth is inflamed. The patient is not inflammation. The root canal is a start which will be performed in 3 appointments. In the first, remove the entire nerve from the tooth and fill with medicine. After about 7 days, the patient returns to his second appointment where the medicine is removed. The tooth is checked, and if all is well, the canal is filled and provisional plaster is placed. The provisional of the tooth is taken to have its crown made and filling at the third appointment. The crown is placed. Week 10. Some of the reasons for extracting teeth are usually a deep infection in a tooth abscess, crowned teeth, or improperly placed teeth, gum disease that loosen or damage teeth. Problems can arise after extractions, general post-surgical effects such as pain, swelling, bruising, bleeding, and infections. Some pain, swelling, and bruising in the area can be expected from most patients. Week 11. The causes of gum disease: poor oral healthy habits, smoking or chewing tobacco, hormonal change, some ways to prevent gum disease: brush from 2 to 3 times, at least twice a day, with fluoride toothpaste. Make sure to brush the gum line. Floss daily to remove plaque from places that the toothbrush can reach. Weak TMG disorders can cause pain in the jaw joint and eat the muscles that control jaw movements. Some ways to treat temporomandibular joint syndrome. 12. Temporomandibular joint syndrome. The temporomandibular joint acts as a sliding hinge that connects the jaw to the skull. It has a joint on each side of the jaw. A dental split, occlusal split, or a stabilization split or bit wart, which a dental appliance placed in the mouth that keeps the teeth aligned and prevents teeth grinding. This resembles a mouth wart and is usually prescribed and fitted by a jaw specialist. 2. Physical therapy with jaw exercise can strengthen muscles, improve flexibility, and range of motions. 3. In several cases, jaw surgery or dental surgery may be necessary. Week 13. Some of different causes of infection in the mouth are bacteria that develops in the gum or tongue, viruses that cause sores in the mouth, bad habits such as alcohol and tobacco, and some ways to treat these infections are with antibiotics, antifungals, like good dental hygiene. Week 14. Some of the signs of oral cancer is wild or red patch on the gums, tongue, tonsils, or the lining of the mouth. Pain is the teeth or jaw, persistent but bright, a lump or thickening on the cheek. Dentists can detect mouth cancer by extraoral scan and intraoral cavity scan. Week 14. Some oral and maxillofacial procedures are dental extractions or extractions, corrective jaw surgery, jaw reconstructions, and dental implants. People may require oral and maxillofacial surgery when you want to solve aesthetic problems caused by malformation of the facial skeleton that cause a misaligned position and contact between the teeth. Week 16. Dental anesthesiology is a drug that is administered in order to make disappear or reduce pain before any dental procedure. Anesthesia numbs the area to be treated, producing a nerve block. Some common types of anesthetic are local anesthesia, cream and gels, concussions, sedation, mild sedation, general anesthetic, oral sedation, non-needle anesthesia, all depending on the product and application. Week 17. Some examples of over-the-counter drugs are usually accepted, such as paracetamol, non-steroidal anti-inflammatory, such as ibuprofen, nexaprofen, narcotics, and the uses of medication in dentistry. Some medications are used in dentistry to prevent inflammation and tooth infections.